people come, they don't have any of their documents or anything like their ID. We're the only industrialized country in the world without a universal healthcare system. We know as a country that we spend more on healthcare, but have worse health outcomes than other countries who are our peers and our competitors. There's a human cost and an economic cost and a societal cost for not having a system of care for everyone. So I'm on a special assignment for a couple of years working on an initiative that involves partnerships with other organizations that provide healthcare in our community. I oversee what's called our Children's Health Initiative. It was launched in 2002 with a goal of universal health coverage for children so that any child in San Mateo County has access to health care. When we began, we estimated there were about 17,000 children in San Mateo County without health insurance.
Dígame, ¿qué le puedo ayudar? Ahorita le voy a dar una forma para que le llene también al señor.
Cada semana anota en la libreta lo que él ganó.
Ok, perfecto.
6 years in, we have universal coverage for children in our community.
In 2005, our team, Partners in Health, was asked to go to Rwanda, both by President Clinton and President Kagame of Rwanda, to try to scale up a model of HIV treatment and care based in a primary healthcare model. So we were asked to start 2 hospitals and work in 6 health centers in eastern Rwanda, where there were no hospitals and there was very little healthcare. My name is Henry Epino. I went to Stanford from 1992 to 1996. I am currently the medical director for Partners in Health in Rwanda, and I also am an emergency medicine doctor in Boston at one of the teaching hospitals there. As Partners in Health in Rwanda is very much an organization for the Rwandese people. It's a Rwandan-run organization, and the goal is that expats like myself, continue to work there in Rwanda in solidarity with our local teams, but they have the capacity and they take the leadership of the programs.
Numva ko nzatanga umusanzu w'ibitekerezo byanjye cyangwa n'ingufu zanjye ku kibazo kijyanye n'ubwandu kugira ngo turebe mu by'ukuri ko abanduye batapfa.
The hardest part of the job is knowing that there will always be more sick people, there will always be more suffering, and that the cycle of poverty is something that we cannot eliminate in a day. The poverty is actually the real problem. People often suffer poor health outcomes because they do not have the access to clean water, to a hospital, to a health center.
So we're in Redwood City, a relatively industrial area, and we do work on things like concentration of liquor stores, and especially around a school or around areas where children congregate, the health impacts of that. Marketing to low-income communities that don't have a lot of other resources to get to fresh fruits and vegetables as an alternative. I think the issue of health is a really basic one, and sometimes we don't know what it means until we don't have it. When I reflect back on my Stanford experiences, one thing I appreciate is that I got to practice a lot at the Haas Center. Stanford gave me that plate to try something. Fail, try again. Follow your curiosity.
A lot of things have taken me by surprise. I'm surprised with how much I enjoy the work. I'm also surprised by how challenging the work can be at times. I find myself lucky every day knowing that I get to do something I really enjoy and find meaning in.
Our world needs more people committed to public service.
Our world needs more organizers.
More imagination and creativity for problem solving.
Hope. More engaged citizens.
Caring about others and trying to think outside oneself.
Our world needs more people who are willing to sacrifice for others.